Hello, everyone. It's exciting to be a part of today's discussion. The Cure Corridor is exciting as there's a common commitment amongst all the companies here that we're improving the quality of life. It's that simple. At Gobiquity, we are really addressing an issue that probably most people take for granted. Today, over 400 million people around the world, or in 2020 that is, will have vision impairment. And the interesting fact, this is a global phenomenon, and the interesting fact is that 80% of the vision issues around the world are either preventable or can be treated. Yet the greatest challenge that's out there is access to care and identifying the right patient at the right time. And there's a disproportionate number of eye care professionals that can actually help to treat the right patients. What's also, though, exciting that can help us overcome this gap is really where there's adoption of technology, in particular around smartphones and digital technology, that's going to allow for the potential of treating these conditions or identifying it early. Not to mention, there's also a more empowered consumer where parents want to be more empowered, the consumer wants to look after their care, they want a better quality of life. And that convergence is what Gobiquity is built around. What we have done is we're building a platform that allows for early detection and prevention of vision impairment utilizing broadly available technology. Your iPhone is the perfect example. And what we're focusing on is developing a whole suite that's going to encompass and allow for all health constituents, not only the physicians, but also the patients, to actually manage their vision and try to avoid the onset of vision impairment. And we're initially focusing on the pediatric market, and this is where we have come to market with our product called Go Check Kids. But at the same time, we see a continued growth of our business in terms of the global reach, as well as the entry into the young adults and helping with their development. But not to mention, we're also looking at the adult side, where today, as many people know, diabetes is an epidemic in the marketplace. If there's ways that diabetics can actually avoid the blindness that is very common in terms of the diabetic retinopathy, age is also an issue where age-related macular degeneration is one condition where older generation are losing their central field of vision. The whole premise of what we are built around is trying to identify those vision disorders early so they can be treated. So a little bit about Gobiquity itself. We were actually a company founded in Oregon, at Oregon Health Sciences University. Our founder is David Wong, one of the preeminent ophthalmologists in the world. And we're a venture-backed company. Our background is venture-backed by a firm, primarily Interwest Partners, which is based in the Bay Area, well known for its ophthalmology experience, companies like Glaukos, as well as on the digital health side with companies like Hippocrates and Doximity and Welltalk. We also have an investment from Mark Benioff, who is the founder of Salesforce.com, recognizing the value of the cloud. Everything we do is connected through the cloud. The company itself, though, didn't really launch our first product till 2015, and that's really where we launched Go Check Kids, and I'll talk about that. But we came to the market right after that launch. We came here to the Cure Corridor recognizing a significant opportunity to actually leverage the healthcare base that's here. And we've also completed a fundraising round, and we're actually continuing to invest in our intellectual property. The product that we've come to market with is really an all-in-one vision suite that we're offering health professionals to allow them to use the smartphone camera and flash to analyze a child's eyes in real time to identify potential risks for vision disorders. The numbers are simple, the numbers are significant. 1 out of every 4 children have a vision issue. If you can identify the vision disorders at an early age, they can be treated either to eradicate an eye condition like lazy eye or to actually help them with the child's development. And we've been able to launch this product and offer it to health professionals where they can integrate it into their workflow and actually are able to see that their children are being screened. And having launched this product in January of 2015, we've seen phenomenal adoption. We've screened 175,000 children already, and this number is growing at a substantial rate. Just in the third quarter of this year, I should say, there were 41,000 children screened. That's a 180% increase year over year. And this is something that for us is gratifying. We see in real time the children being caught and identified with vision disorders. More than 7% of children are being identified as vision disorders and being referred to a specialist by their primary care physician. We have already 2,500 physicians using our software and a pipeline of over 7,000 physicians, not only in the United States, but actually globally, that are wanting to utilize our software. And more importantly, we actually want to add and really increase the adoption of our offering and give it to the parent. And that's where we're launching a consumer version of our product this coming year, where we'll allow for the parent to be empowered to be able to screen their child, determine whether or not they have a vision disorder, and at that point be able to see their healthcare professional. What's significant here is that we can overcome the challenge where only 20% of children are screened before the age of 5, and instead allow them to actually be screening 100% of children so that they can be properly treated if they do have a vision disorder, and also have the ability to develop and have the luxury of having the proper education and being able to learn the proper way. So as I had mentioned, the company itself, we're venture-backed. Our backers are Interwest and Mark Benioff. We've been fortunate that we just did close another Series B, our Series B, that for $7 million. That's really going to be used for the continued growth of our business, both on adding to our health professional network, extending our offering to the consumer, but also advancing our offering to go globally. And we are expanding the portfolio of products so that we can treat the younger adults as well as those older adults with the age-related vision disorders. So I'd like to thank everyone today, and once again, I thank everyone for the commitment that the Cure Corridor is having, and the city of Scottsdale to allow Gobiquity to come here and keeping such an open door to allow us to be speaking with so many great companies and so many great constituents in the ecosystem. Thank you.